Why do you need to use the brain to treat the nose?
The opposite. Why do we need the nose to treat the brain?
Okay.
So the nose is our pathway to the brain. It's essentially
Okay.
a pathway to the brain because the back of the nose, which is the last sinus inside our nose, is just one very thin bone away from the brain.
Okay. Let us talk about the sinus first. कि ये sinus क्या होता है? Because हम colloquially लोगों को सुनते हैं, मुझे sinus की दिक्कत है.
बिल्कुल.
मुझे sinusitis है, right?
Absolutely.
So,
many people say that they come to me saying, "Sir, मुझे sinus है," not knowing what the word sinus means exactly.
right. So let's start with this. What is the sinus, and how does it sort of हमारी body के अंदर उसका क्या use है?
Okay, good way to start. So inside our nose, first of all, when we look through the nose, that's these openings over here. When we go inside beyond that, we see our nasal cavity. Inside the nasal cavity, in the center is a bone, जिसे हम कहते हैं septum. Divides the right side of the nose from the left side of the nose. Further inside the nose, we have the sinuses. Now we have 4 sinuses on each side of the nose. 4 on the right, 4 on the left. There are 4 sinuses on the right. The maxillary sinus. Sorry, this might get a little technical.
No, that's fine.
Maxillary sinus, the ethmoid sinus around the eyes, the frontal sinus behind your eyebrows, and then the sphenoid sinus all the way at the back. So you have 4 on the right, 4 on the left. What are these sinuses? Sinuses are essentially open air-filled spaces where when we breathe through the nose, literally the wind that we are breathing or the air that we are breathing goes in the nose, travels all through all those sinuses, gets filtered, and then is going down into the trachea and the lungs. That is essentially what the sinus is.
Got it. 2 things from there. Number 1, जब किसी को sinus या sinusitis होता है, is that कि जो हमारी बलगम या phlegm होती है वहाँ जमा हो जाती है. That's number 1. Second, there has been this thing on the rise called a lymphatic drainage massage. Essentially, अगर आप अपने यही आपने जो areas बोले अगर आप इनको ऐसे massage करते हो, you feel what I would call facial relief, perhaps a surge in energy levels. How is that connected to this?
Okay, so first of all, you asked what is sinusitis. Yes, sinusitis does mean that. Sinusitis essentially means inflammation or infection inside those sinuses.
Okay.
Those sinuses open up into our nasal passages by these very tiny openings. With repeated colds or upper respiratory tract infections, these openings close up. That is what becomes chronic sinusitis, where now whatever balgam jaise aapne bataya is getting stuck inside those sinuses and not able to come out on its own, which is what usually happens. For example, if you get a cold, you don't necessarily have an attack of sinusitis because that cold clears itself out. After 10, 20 or 30 times of cold over many years, it can get blocked inside the sinus and not come out on its own.
Got it.
Where you potentially need antibiotics, medication, or in a worst case scenario, surgery to open up those sinuses and get that fluid out.
If you want to watch small segments of the podcast, subscribe to Dostcast Clips.
So when someone comes and says, I have sinus, they usually mean that there is this heaviness, nasal discharge, pain, like you said, over around the eyes, on the forehead, etc. Second thing you mentioned about the sinus massage. Now, our sinuses normally have what we call cilia, or microscopic hair-like structures coating the inside of the sinuses, which as a norm and what their job is to clear out mucus from the sinus. That is their normal job. When they're unable to do that, we get sinusitis. Now you mentioning pressing and sinus massage, yes, can potentially help in a case of acute sinusitis where there is fluid stuck and you're essentially just trying to push it. But now remember, you're pushing just on bone. Beyond that bone is that sinus. But yes, pressing might help a little bit of that discharge to come out through its normal opening, which might give you a little bit of relief.
So then, अब ये तो anatomy की चीज हो गई, but let me ask you this. अगर मेरे पास एक नाक है और उसके अंदर मेरा respiratory tract वहीं से जाता है और मेरी lungs में जा रहा है,
बिल्कुल.
Why do I need additional air spaces to breathe in my face?
So great question. So the sinuses are not just for breathing. Yes, when we breathe, it goes directly into the nose, into the sinuses and back. Now what the sinuses does, what their job is, part of the job of the nose and the sinuses is one, filtering the air that we breathe. Secondly, as importantly, is bringing, for example, if I'm breathing very cold air, my nose and my sinuses are going to regulate that temperature and get it to body temperature within less than a second of me breathing that air and that air going into the lungs.
Okay.
So the sinuses, for example, if I'm breathing very cold air, it's going to bring that air very, very rapidly to room temperature. And if I'm breathing very hot air, it's going to bring up that cool down that temperature to body temperature for it to go into the lungs.
If I were to slash someone's cheeks and their यहाँ पे जो ये जगह है, will that potentially disrupt their respiration?
Not necessarily, because this is just skin and fat below this. उसके नीचे हड्डी भी है.
हड्डी के पीछे साइनस होता है.
बिल्कुल. Correct. So beneath the bones of your face, the bones of your forehead, your skull, behind the eyes, around the eyes is where the sinuses are.
Okay.
These are bony spaces filled with air.
Understood. So, number one, why is this sinusitis or an inflammation of the sinuses so common?
Okay. So you could get sinusitis for one of many reasons. Okay. Most often is an infection of the upper respiratory tract, which is the nose and the back of the throat. Okay. Mostly this happens most commonly in kids because they're exposed to bacteria, viruses, fungi. You can get sinusitis from any one of these, not just from a bacterial infection. You can get sinusitis from something that you are allergic to in the air. There are fungi in the air which we don't even know we're breathing in, which over a course of a long period of time, repeated infections can cause sinusitis. It's stuff we're breathing in the air. So it can happen. It's very difficult to control. Can you wear a mask 24 hours a day? No, you cannot. There's physical contact with people around us. Who knows what they might have, bacteria, fungi, whatever it might be. You're just breathing this in.
Understood.
That's why it's so common. On top of which, like you already mentioned, the AQI, bad getting worse.